thinking has bridged academia and its role in actually implementing policy. Can you talk about what your thoughts are on making the legislative process more informed and what role you think fresh thinking has played in this over the past 3 years?
I know everyone wishes that there were a more direct connection between good, solid policy research and what takes place in legislature. I'm not sure that bridge is an easy one to build. I'm not sure. I think that our job as academics is mainly to find out what is the right thing to do, to understand the causal relationships. I think that probably there are others, not in academia, who are better equipped to make the translation between that and actual policy. The notion that you can just take things off the research agenda and move them right into policy, I think is a wish that is not likely to be fulfilled. If I think of some of the successful policy changes of the past, consider something like welfare reform, which Bill Clinton and the Congress put through together. The research leading up to that goes back a couple of decades, and why it actually happened at the time it did and so on is something for other people to try to understand.
But do you think that something like fresh thinking and its 3 years of discussions could possibly be that venue of getting research into policy?
I don't really think so, no. I think you think of it as a stage. Think of the medical school and think of the people who are trying to understand the genes and understand the proteins that are created by the genes and their relationship to potential disease and cures and so forth. There's a big step between that and moving to drugs that can actually help people.
Right.
And they call that translational medicine. In fact, there's a new journal that science is starting called Science Translational Medicine. The senior editor of that journal was at the Fresh Thinking Conference.
Yes.
And did you meet her?
I didn't meet her.
Kelly,
I'd emailed with her.
Kelly Lamarco,
yeah.
And she's coming down to see me. She's asked me to be on the advisory board, which I agreed to do. We'll see how that, and she says they're going to have something in the journal about policy as well as on straight science and drugs and so on. And we'll see how that plays out. But I'm not overly optimistic. It's a different world, the world of politics. There are people who understand it. There are people who are masters of it, like Rahm Emanuel and so on. But they're not in the policy world, and the people who do policy research, for the most part, are not in that world.
You've been involved in healthcare research for a few decades now. Can you talk about...
How many decades?
You tell me how many decades.
More than 4.
More than 4 decades now. Given that vantage point, can you kind of put into perspective current healthcare reform efforts?
Well, the problems are pretty much the same as they've always been, and that is figure out a way to cover the uninsured, figure out a way to contain costs, and especially the increase in costs from year to year, and figure out a way to improve the quality of care. These are sort of the enduring problems, and they're no different today than they were 10, 20, 30, 40 years ago. The difference is now more difficult to find some kinds of solutions that would be moderate or middle-of-the-road solutions. We used to think that America was essentially a moderate country and that it avoided extremes on the right and the left. And that is still true if you think about the country as a whole, but if you think about the Congress, of course, it's a much more polarized institution than it used to be. And that's why, since my own preferences, policy preferences and values lie in the middle, I describe myself as a radical moderate, I become more and more disheartened by the antics of Congress. Although he comes from a liberal left position, is striving to find a middle road. There's a fellow in the House of Representatives named Jim Cooper from Tennessee who's trying. But those are not the voices that get the most attention. And the press, of course, has also become more polarized, particularly if you include in the press the television. Many of the channels now are so clearly identified with one political position or another, instead of being a kind of medium to present all points of view.